diagnosing COVID-19 even harder. As countries strengthen surveillance for COVID-19, they must simultaneously monitor influenza cases. Early vaccination to prevent severe cases of flu is more critical than ever, particularly for high-risk groups like health workers, the elderly, and people with chronic conditions. These same groups are also at high risk of coronavirus infection. We have encouraged countries to adapt seasonal flu vaccination campaigns to fit current social distancing measures. Many countries have embraced this approach and introduced innovative methods of immunization that minimize the risk of COVID-19. This includes offering vaccines outside of health facilities in empty schools, for instance, pharmacies, or drive-through posts in supermarkets. We have been encouraged that 14 countries in our region have begun to immunize 90 million people against seasonal influenza. More than half of the target population has already been vaccinated, a testament to the preparations and diligence of governments in the region. PAHO is helping countries secure the necessary doses of vaccines to reach this goal. Through the revolving fund, we pool resources to purchase vaccines from member states in an effort to expand access, to guarantee quality, and to secure better prices. This year, the fund helped secure 24 million flu vaccine doses. Virtually all of it has already been delivered to countries conducting campaigns, despite the added logistical hurdles that we are all facing in transporting essential supplies during the pandemic. As we move north across our region, countries in the Caribbean, Central America, as well as the eastern and southern coast of the United States are bracing for what many experts believe could be one of the worst hurricane seasons on record. More unprecedented still is the prospect of responding to a hurricane amid a pandemic. As storms ravage towns and communities, they decimate sanitation systems, they contaminate water supplies, and fracture the delivery of healthcare. Three lifelines that are critical to containing the spread of COVID-19. For countries in the path of a storm, I remind you that PAHO is here to help you prepare and will be ready to support you in the event of an emergency. Now is the time to review national hurricane response plans and conduct simulation exercises to ensure your disaster and COVID-19 responses are aligned. We should also plan for potential disruptions to the care of critically ill patients and refine evacuation plans. PAHO has already issued guidance to manage emergency shelters, including precautions to minimize the spread of COVID-19 by designating distinct zones to allow for social distancing, regularly disinfecting high traffic areas, and swiftly isolating individuals who show signs of illness. We are working to provide emergency response supplies throughout our region and to secure critical facilities like laboratories and quarantine and isolation centers so diagnosis and treatment for COVID-19 can continue even under difficult circumstances. The COVID-19 pandemic has pushed our region to the limit. Our communities and health systems are under duress, and our collective efforts are laser focused on containing the virus. Preparing for winter and hurricane season is a critical part of this fight. We must take action today to safeguard our progress and mitigate the spread of the virus during this time. And this means redoubling our efforts to control the spread of COVID-19 so that we reduce the dual burden the approaching winter and hurricane seasons might bring. It also means strengthening health infrastructure by hiring surge staff and expanding reserves of essential supplies and protective equipment. This will help ensure the work done to prepare for COVID 19 is reinforced to address these seasonal threats. The Americas region is no stranger to natural disasters or seasonal health outbreaks. Indeed, our experience navigating these challenges has fueled our resilience in the fight against COVID 19. We must rely on that experience now more than ever, just as we must rely on regional solidarity and partnerships. Our history shows that if we work together, we can overcome the worst. And this time is no different. Thank you.
Muchas gracias, doctora Etienne. Vamos a comenzar ahora con las preguntas que hemos recibido por correo electrónico y luego pasaremos a las preguntas del chat. Como mencionamos, tienen que hacerlas por el botón que se llama QIA y allí las estaremos tomando y respondiendo. Y si les pedimos que por favor se identifiquen con su nombre y su medio de comunicación. Primera pregunta viene de varios reporteros, nos llegó por correo de AFP, Reuters, AP, también de Nicole Shapur de Bloomberg y ahora en el chat también Mariana Souquet de Efecto Cocuyo preguntan sobre Venezuela. La pregunta, voy a pasar a inglés. It's about an agreement among the Ministry of Health from Venezuela, the representative for health from the National Assembly, and PAHO to look for resources for the response against COVID-19 in the country. Can you elaborate on the content of the agreement and what is PAHO's role and how this support and the seek for resources will be implemented? Doctora Etienne.
Thank you, Sebastian, and thank you for this question. Indeed, COVID 19 has been challenging for most countries, but this pandemic also provides a good opportunity to pursue health as a bridge for peace. It takes high commitment, courage, and a sense of urgency to put aside political and ideological differences to reach an agreement to protect the lives of the people. And so that is precisely the nature of the collaboration agreement that was signed in Venezuela following multiple dialogues and negotiations that was facilitated by PAHO at both the technical and political levels. It is clearly a very important step, and I must say that PAHO is privileged to confirm its renewed commitment to continue serving the population of Venezuela. It is also a responsibility for us to deliver technical cooperation in keeping with humanitarian principles and to deliver with technical excellence. Although the agreement is an important milestone, it will require continuous, transparent, and unwavering joint work to deliver the results that all Venezuelans urgently need. I am glad to report that this morning the Ministry of Popular Power for Health and the advisory team of the National Assembly met again in Caracas under the auspices of PAHO to discuss specific actions to save lives and reduce COVID 19 transmission within this agreement. So the parties agreed, among other things, to prioritize access to PPEs, medicines and supplies for treatment and ICU services, to decentralize testing, and to prioritize the states that are most affected. We in PAHO are optimistic and confident that concrete results are now closer than ever. Thank you.
Gracias, doctora Etienne. La siguiente pregunta nos llega de Anatoly Kurmanaev de New York Times y en inglés dice, Peru and Brazil now have similar numbers of COVID cases and deaths per million despite adopting radically different strategies. Peru adopted all the best practices advocated by WHO, Brazil adopted none, yet the outcome has been similar. As Latin America countries begin winding down the lockdowns to stop the economic free fall, what impact can it have on the region? What incentives do countries have to maintain economic restrictions if the deadly outbreaks appear to be a question of when, not if? Dr. Barbosa?
Thank you for the question. This is a complex question because indeed you are asking more than two or three questions and make some assumptions that we need to discuss. First, I don't agree that Brazil has not implemented any measure to reduce the transmission. In Brazil, this decision relies on the governors, and almost every state in Brazil has adopted different packages of measures aiming to reduce the speed of the transmission, varying from uh, quarantine measures, social distancing measures, lockdown measures. So we have a mosaic of distinct situations among the states in Brazil. Second, I agree that Peru implemented many important measures. Peru was one of the first countries to establish very important economic support to the poor population. Other countries, including Brazil and other countries in the region, adopt the same measures afterwards because it's very important to guarantee that the population will be supported if we want them to agree or to support or to adhere to a stay-at-home policy, for instance. When we look to the figures, the mortality rate in Brazil and the Peru, they are similar. You are correct about that. But when we look in some states of Brazil, for instance, the Amazon state in Brazil, that is a poor state in the north, the mortality rate in Amazon state is almost 8 times, sorry, the mortality rate that we have in Peru. So I think that we need not only to the national average, but in some countries in the United States, you know, the reality is totally different when you go state by state. So I think that we need a more deep analysis to make the right comparison. About the difficulties, I agree with you that Latin America is the first region worldwide where the COVID-19 is hitting economies that have a large proportion of the economy as informal economies, that we have many families living below the poverty line. Some countries of Latin America, only 30 or 40% of the families have a refrigerator, so they need to leave their house frequently to buy food. So it's a very challenging situation. The countries are adopting at the same time measures to reduce the speed of the transmission, social distancing measures. They are strengthening their health services. And in many countries, they are planning starting opening the economy, but they are being very cautious and they are following their recommendation to monitor the situation to be sure that in the areas or cities or municipalities or states, the transmission is controlled before starting open the economy, and to do this, monitoring very closely the epidemiological indicators and the occupancy rate of hospital beds and other indicators very closely. Thank you.
Gracias, doctor. La siguiente pregunta nos llega de Sebastián Boyd de Bloomberg y en inglés pregunta, are there any specific conditions in Peru and Chile, such as climate, urbanization, or popular density, that would account for the rise in cases per capita there despite quarantines and social distancing? Both countries have roughly one-third of their population living in the capital region. Could that be a factor? Dr. Aldigueri?
Thank you for the question regarding Chile and Peru. Uh, this question is also linked to some aspects that were characterized by Dr. Barbosa answering the previous questions. In Peru, the incidence rate is higher, you are right, in the big Lima area, including the port of Callao, but also in the Amazon region, the department of Loreto, and the northern Pacific coast, the department of Piura. In Chile, as for Peru, we have a high incidence rate in the big Santiago, the capital city area, but also in provinces of the Northern Pacific, Tarapacá, and in the deep south, I mean on the Patagonian side, the province of Magallanes. So what we have in common between these two countries and the big urban areas is high density of population. It is poverty that is related to overcrowded households with difficulty of the people distancing from their relatives living in very small households, but also this poverty triggers some different social mechanisms. It means that the people earn every day the money that they eat with. So they have to go outside, they have to look for work, they have to look for transportation, which is another challenge in terms of social distancing. They are looking for food, they are going to markets, which is also another challenge in terms of mass gathering. So we have in these big urban areas, of course, many risk factors and challenges for strictly implementing the public health measures. So we have a risk of amplification. This was also described in other areas of mega cities, the big cities of other countries of South America. We are seeing the big cities as an amplification area with all these layers of risk factors that I described. Thank you.
Gracias, doctor. Siguiente pregunta viene de Fernando Melis de r7.com de Brasil. Y luego uniré con otra pregunta relacionada que nos acaba de llegar por el chat. Y la pregunta de Fernando Melis es: el presidente de Brasil amenazó con retirar al país de la OMS, acusando a la organización de tener sesgo ideológico. ¿Podría esa medida perjudicar a Brasil en términos de acceso a vacunas y medicamentos contra COVID-19? Y vinculado también con el tema de vacunas, no específicamente de Brasil, pero general, Emiliano Rodríguez de Nature Magazine pregunta, dice que hay cierta preocupación de investigaciones porque las vacunas no lleguen a todos los países en tiempo, si hay preocupación de la OPS en este sentido para la región. Doctor Espinal, ¿podría tomar esta pregunta?
Muchas gracias, Fernando, por esta pregunta y por la subsecuente acerca de vacunas. Brasil tiene una larga tradición de cooperación con la OMS y la OPS. Brasil ha sido un tremendo actor en todas las Américas y fuera de las Américas, porque Brasil tiene una gran tradición de solidaridad y de panamericanismo, además que hace frontera con 10 países. Entonces, la organización estará presta para continuar apoyando a Brasil. No vamos a permitir que vacunas o medicinas nuevas no van a llegar a Brasil, porque la organización estará presta para facilitar esa llegada, por ejemplo, a través de nuestro fondo estratégico para insumos y commodities o medicinas, y también para nuestro fondo rotatorio. La organización continuará trabajando con Brasil. Pero voy un poco más allá. La organización ha estado trabajando en estos momentos con la prioridad, con COVID. Hemos facilitado la ayuda para la compra de 10 millones de test. Hemos capacitado personal de salud en Manaus y en otras áreas. hemos realizado reuniones virtuales de educación y web seminars, como decimos, le llamamos. Pero va más allá de todo esto. Brasil tiene una historia de cooperación, produce vacunas Brasil y la facilita a muchos de nuestros Estados miembros, pero también en el área de salud mental, en el área de controlar el tabaquismo, en las enfermedades transmisibles, larga tradición de cooperación en tuberculosis, VIH, malaria y de no transmisible, cáncer. Pero lo más importante, y es donde nosotros creemos que las acciones del COVID, contra el COVID tienen un gran impacto. Brasil tiene un sistema de salud, el SUS, es único, es una joya que muy basado y que cubre todo el país en la atención primaria. En una epidemia que va a tener a largo plazo, el rol del SUS va a ser vital. Así que creemos que independientemente de, como decía la directora, de las cosas políticas, nuestra organización, la OMS y la OPS, continuarán apoyando a Brasil para que las vacunas, las medicinas lleguen a la población de Brasil. Muchas gracias.
Muchas gracias, doctor Espinal.
La vacuna. Sí. La vacuna, la segunda pregunta, perdón, Sebastián. Sí, es la misma respuesta, básicamente. La organización está trabajando trabaja con la OMS, pero con otros socios muy importantes en el área de compras y suplidores. Entonces, tan pronto tengamos medicinas y vacunas, no quede duda que la OPS va a hacer los mejores esfuerzos para que a todos nuestros países llegue la vacuna, llegue la medicina, ya cuando estén probadas y aprobadas mediante los organismos también regulatorios y mediante los ensayos clínicos del lugar que en estos momentos se vienen realizando. Muchas gracias.
Gracias, doctor. Siguiente pregunta nos llega de Jennifer Abbasi de Hama Network. Pregunta en inglés. What is the status of PPE and ventilators in Latin America? And what are the main initiatives to provide adequate medical supplies to the region? What is the status of availability of hospital beds and ICU beds? Dr. Ugarte.
There are, the global market in general has not recovered yet at previous levels. And there is a need to increase production, but also to deliver those supplies to the countries that are in most need. In the case of the Americas, there is a general shortage of PPEs and ventilators. And the shortage is more noticeable in the places where there is an increase of number of cases. So in those areas, we are seeing that there is a higher proportion of healthcare workers that are getting infected with COVID-19, but also the population and the patients do not have access to critical care. In those areas, we are seeing that the distribution of PPEs is a priority, and the global supply chain, that is an interagency consortium to procure essential supplies, have been negotiating with all the countries and many other entities. And we are now seeing that those supplies are beginning to be sent to the countries. In the case of the Americas, there are many countries that will receive supplies in the next week or so. And we can mention Antigua and Barbuda, Bahamas, Barbados, Belize, Bolivia, Cuba, Dominican Republic, Nicaragua, Panama, St. Kitts and Nevis, Suriname, Venezuela, Ecuador, and Peru, to name the first ones that will receive those supplies. And those supplies are being negotiated through several channels. One of them is the country's own resources that through the PAJOS Strategic Fund is the biggest channel to purchase those supplies that would not be available for the countries if that channel will not be used. And the other area is the donation from international institutions that will also allow us to purchase for those countries that do not have supplies. And I would like to mention that each country is monitoring the availability of hospital beds and ICU beds. And we are seeing that the countries are implementing a sharp increase in the availability of those supplies, and even establishing modular hospitals or expanding the capacity, specifically in the areas where the number of cases are increasing dramatically. Over.
Gracias, doctor. Vamos a pasar a algunas preguntas en vivo. Voy a darle la palabra a Richard Ensor, corresponsal en México del Economist. Richard, si nos escuchas, tienes la palabra.
Sí, muchas gracias. I will speak in English if it's okay. I will ask the director a question, which I've written also in the Q&A section. If you look at the data from the governments around the world, it shows that Latin America right now has become the global center of this pandemic. The number of daily new cases that we are seeing is, if you take a 7-day rolling average, it exceeds the peaks seen both in the United States and in Europe in early April or thereabouts. Now, both of those parts of the world fixed that situation by implementing very harsh lockdowns. And those kinds of lockdowns are not very common in Latin America. And indeed, lots of Latin American countries have already implemented lockdowns. And this increase that I'm describing has taken place with these so-called lockdowns in Latin America already underway. So with this in mind, where does your optimism come from that this situation in Latin America is not going to drastically worsen in the coming weeks, considering that the tool that solved this problem in Europe and North America is not being applied in Latin America?
Gracias, Richard. Doctor Espinal, ¿puede tomar esta pregunta?
Thank you, Richard. I think I lost the last piece of the question, but I think it was you were referring to the fact of Latin American implementing lockdowns also, but seeing a higher number and being the epicenter of the epidemic. Is that correct? No. So I think Sebastian, that was the.
Yes, he wanted to know it's like also like how data shows that Latin America has become now the center of the pandemic and why.
Yeah, yeah, indeed. And apologies for that. The Latin America, as you know, had more time to implement measures, indeed, because it affected first China and then Europe. But at the same time, we know that Latin America is the most inequitable region in the world and also one of the most urbanized regions in the world. So we have big cities like Rio, Sao Paulo, Lima, in where they are surrounded by belt of poverty and inequities. So the same lockdown that was applied in Europe to a certain extent cannot be completely applied in Latin America and the Caribbean. If you look into account that the economies are shrinking in many of these countries, so and we have countries with a high informal economy, it's very difficult to implement a total lockdown. The other point is that in several countries in Latin America, the outbreak started with imported cases, and it didn't reach the poor areas immediately. So, and we have seen in some of the countries later at the latest peaks that, meaning also that, and we know that is going into the areas where poorer people live, where people live in more crowded conditions. So the situation is that that while Latin America had more time, it probably will take more time to ensure slowing down the peak, the pandemic, and also reaching the plateauing the curve, it will take more time. And that's why we recommend in countries, if you are going to reopen, you have to do it first to do a proper analysis, put together in the same table economic, financial people with public health people, but also do it by phases, because it's not going to be a situation that, in other words, we're going to have COVID for some more time, and June is a critical month. So it is expected that Latin America could have a big impact in terms of being the epicenter because of the situation and the characteristics of the region. We have middle-income countries, but also low-income countries, and many of the middle-income countries are in the lower category of middle income. I hope that's answer your question. Thank you. Over.
Gracias, doctor. Le voy a dar la palabra también a Uriel Velázquez, de Despacho 505 de Nicaragua, para que haga su pregunta. Uriel, si nos escuchas.
Hola, ¿me escuchas, Sebastián?
Sí, adelante.
Yo quisiera preguntar, bueno, esta última semana han pasado un poco en Nicaragua, pero he tratado de concretar 3 preguntas básicas. En Nicaragua se ha señalado al gobierno de Nicaragua de reducir la capacidad de respuesta ante el COVID-19 por despedir a médicos especialistas, por criticar la mala gestión en esta crisis. Ahora mismo que estamos en esta conferencia, nos están llegando 3 nuevos reportes de despidos en hospitales públicos de Nicaragua que tiene que comentar la OPS al respecto. También quisiera saber, si bien es cierto que el gobierno se ha negado a recibir una omisión de la OPS en Nicaragua, ustedes ya tienen una representación permanente en el país. ¿Qué está haciendo esta representación para cooperar en esta situación de emergencia? El doctor Ugarte ya mencionó que van a enviar insumos médicos, insumos al país. En detalle quisiéramos saber en qué consiste esta donación y qué protocolos estarían implementando para hacer que estos insumos verdaderamente lleguen a quien tenga que llegar, porque se ha denunciado también, los mismos médicos aquí lo han dicho, que ha habido donaciones de otros países de mascarillas y de otros insumos, pero no están llegando a los hospitales. Y por último, quisiera que nos hicieran una valoración y una proyección sobre la situación del país de acuerdo a los últimos datos que les han llegado. Gracias.
Gracias, Uriel. Doctor Ugarte, ¿puede tomar esta pregunta?
Sí, la situación de los trabajadores de salud en todo el mundo, pero en particular en Nicaragua, es una situación que debe tomarse con prioridad. Aquellas personas que defienden la salud y la vida de las personas deberían también ser protegidas en todos los ámbitos. Y en este aspecto, ese es un llamado específico para que los trabajadores de salud, los médicos, las enfermeras, los técnicos, los laboratoristas y todos aquellos que estén contribuyendo a la respuesta al COVID sean protegidos. El segundo tema respecto a qué es lo que hace la OPS. La OPS sigue proveyendo cooperación técnica a través del envío de actualización de documentos, de manuales, diseminando información a través de todos los canales públicos y privados con los cuales tenemos acceso. Pero adicionalmente, respecto a los suministros, nosotros estamos previendo un envío adicional de pruebas de diagnóstico, pero también equipo de protección personal. Puedo mencionar, por ejemplo, algunas cifras. Máscaras, por ejemplo, son 93,000 máscaras, guantes 166,000, batas, mascarillas médicas 763,000, etcétera, etcétera. La cantidad que se está enviando es alrededor de 1 millón y que van a llegar en los próximos días. Asegurar que esos suministros lleguen a donde se necesita es un trabajo conjunto. Y en ese aspecto hemos iniciado contactos también con entidades dentro de Nicaragua que puedan asegurar que esos suministros lleguen a donde se necesitan y se usen adecuadamente. nuestra visión de la situación de los casos y de la transmisión comunitaria en Nicaragua es que requiere la respuesta de todos los sectores y debería ser transparente y abierta. Y en este aspecto es muy importante señalar que algunas de las medidas que estamos conversando y que las preguntas que han sido contestadas anteriormente sobre distanciamiento social tienen que implementarse. Y estamos viendo que la población de Nicaragua voluntariamente y las sociedades científicas y otros están procurando que ese distanciamiento social se realice. Aún estamos preocupados que hay activamente llamados a concentraciones y ferias sin la protección adecuada, y estamos viendo también que en los casos donde ocurre eso, el incremento de casos y la cantidad de fallecidos puede incrementarse importantemente. Gracias.
Gracias, doctor. Tenemos varias preguntas todavía que nos han llegado. La siguiente es de Olive González de Trinidad and Tobago Newsday, y también en el mismo sentido pregunta Lara Piñero de G1 de Brasil. Dicen that yesterday an official at the WHO said that the spread from COVID from an asymptomatic person is rare. And they want to know if we agree with that, and also if people should keep wearing masks in that case. Dr. Aldiguieri, could you take this question?
Yes, thank you for the questions, for the two questions, in fact. Yes, we share the same views as the WHO technical lead that was interviewed yesterday. PAO and WHO are doing on a regular basis, I would say every day, and we published almost every other week an update about the scientific literature, about the articles, about the new evidence that are found through scientific surveys and investigations. So in this case, it is very important to make the difference between asymptomatic people that are not presenting any symptoms at any moment of their disease, and pre-symptomatic people that are not yet with, for example, fever and cough. So what the evidence at the moment shows is that it's less likely to have transmission from people that are totally asymptomatic with no symptoms at no moment compared to the people pre-symptomatic. And how we know that? It's mainly through the contact tracing and the cluster investigation, where patients' contacts, symptomatic, pre-symptomatic, asymptomatics are clearly identified. The second part of the question is that in this context of permanent research and review of research, the guidelines from WHO have been updated and published during the last days. And there are specific recommendations for both healthcare personnel and for the public. And doing the difference between the scenario, the tables and the list of scenario are quite long, between the use by the public, non-medical mask, and the use of medical mask. So I will just highlight a couple of examples. In some situations where the social distancing is almost impossible, for example, in the transportation context, the use of non-medical masks is recommended. And in other situations, when we are talking about people with very vulnerable people, depending on the age group and depending on their comorbidities, the use of medical mask when in social activities is recommended. So I really would like to recommend to our colleagues to check both WHO and our website, where all the details are available regarding the update of this guidance. Thanks a lot. Over.
Gracias, doctor. La siguiente pregunta nos llega de Valeria Heredia, del diario El Comercio de Ecuador. Dice, en los países se dieron alertas sobre un brote de sarampión en la región. ¿Cómo avanza este tema? ¿Cuántos casos se han reportado en países como Ecuador? ¿Y cómo podría afectar al sistema de salud en el marco de la pandemia por COVID-19? Doctor Barbosa.
Gracias por la pregunta. Es un tema muy importante porque las otras enfermedades todas que son prioridad para la salud pública necesitan de tener una atención adecuada durante ese periodo. No solo las enfermedades prevenibles por vacunación, como todas las otras, TB, VIH, hipertensión, diabetes y demás. La situación de sarampión hoy en la región es que solo tenemos un brote que está ocurriendo en Brasil. En los otros países donde al principio del año tuvimos transmisión, como México y Argentina, la transmisión ya se ha detenido. Entonces, brote ativo en ese momento solo tenemos en Brasil. En Ecuador tuvimos un caso sospechoso de una niña de 5 meses que tuve un teste de anticuerpos positivo, el teste de PCR fue negativo. Estamos para ahora aguardando el resultado de la segunda muestra. Pero mesmo que esse caso não se confirme, como parece que vai ser um caso de falso positivo, porque a niña não tem história de contato com outros casos de sarampión ou de viagem para o exterior, é necessário manter um sistema de vigilância sobre os casos de sarampión e das outras enfermidades e garantizar o acesso com todos os cuidados que são necessários para garantizar o funcionamento de los servicios que brindan la vacunación a las personas. Gracias.
Gracias, doctor. Ahora tenemos una pregunta en vivo de Gideon Long del Financial Times. Gideon, voy a darte la palabra para que puedas hacer tu pregunta.
Thank you, Sebastian. So my question is, what are your thoughts on the number of excess deaths in the region? And by that, I mean a comparison between the death rates from all causes in the region during the pandemic and the death rate from all causes in the same period of previous years when there was no pandemic. And the reason I ask this is because we recently did an analysis of excess deaths around the world. And one of the areas we looked at was the province of Guayas in Ecuador, around Guayaquil, where there have been around 1,400 deaths from COVID-19 officially. But if you look at the deaths from all causes, there have been more than 12,000 more deaths from all causes between January and May this year than there were in the same period of previous years. Obviously, we don't know the cause of all those excess deaths, but they suggest that the number of COVID deaths could be significantly higher than is being reported, maybe even 7-8 times higher. So my question is, what are your thoughts on the rates of excess deaths in Ecuador and elsewhere in the region, and how seriously should we as journalists take these excess death figures as a possible measure of COVID fatalities? Thank you.
Gracias, Gideon. Quizás doctor Ugarte o doctor Altieri pueden contestar esta pregunta.
Bueno, iniciaré la respuesta indicando que efectivamente se han observado un incremento de. Sorry, I will switch to English. Sorry, the question was done in English. Yes, many countries in the world, in Europe, North America, South America, and in other places, there is an increase on excess of mortality. And there are investigations and researchers that are being looking to the data. And yes, most probably there will be a number of deaths that will be related to COVID. But also, I would like to emphasize that there is also a problem with the availability of health services for other diseases. And that may explain also an increased number of deaths. But in particular, when we saw epidemic of this nature or other nature, we usually look at the number of deaths are less in the numbers, for example, from other related diseases like respiratory diseases. Okay, the population are taking more precautions regarding the transmission of those respiratory diseases, and at the end, we may see a reduction on those type of deaths in comparison. But just to summarize that this is something that is being looked at, and the results may come later, probably several months from now. Over.
Gracias, doctor. Ahora me gustaría también darle la palabra en vivo a Gisela Salomón de la agencia AP. Gisela.
Sí, buenos días. Yo quería preguntar cuál era la posición de la Organización Panamericana de la Salud sobre la decisión de Brasil de dejar de reportar los datos totales de las infecciones y muertes, y también en general qué opinan sobre el manejo de los datos de parte del gobierno del presidente Bolsonaro.
Gracias, Gisela. Doctor Espinal, ¿puede contestar esta pregunta?
Muchas gracias, Gisela, por la pregunta. Los países pueden revisar sus datos. Ya lo vimos cuando empezó la pandemia, la misma China revisó los datos, se vio la revisión de datos también en Nueva York, porque si llegan nuevas informaciones, no es malo revisar los datos. Ahora, debo aclarar que Brasil tiene una larga historia de reportar los datos y tiene un amplio sistema de vigilancia que recoge muchas variables, entonces, mucha información. Entonces, la revisión de los datos no es una sorpresa. Ahora, lo que nosotros sí recomendamos es que se sigan reportando los datos a todos los países, porque eso nos permite y permite a los propios gobiernos de tener una clara visión de lo que está pasando y permite a los diseñadores de políticas de planificar en dónde van a priorizar los lugares más afectados por la pandemia y también cómo podemos ayudar. El estímulo es que estimulamos a los países a que continúen reportando los datos y seguiremos trabajando con todos, pero la revisión de los datos es una prerrogativa que pueden tomar los países y se ha visto. Ahora, sí sugerimos que los datos se continúen reportando. Muchas gracias.
Gracias, doctor. Y la siguiente, estamos llegando al final de la sesión, así que gracias a todos por acompañarnos. Y la siguiente pregunta nos llegaron de varios periodistas también sobre los PPEs, de vuelta los equipos de protección personal y el oxígeno. Y en inglés preguntan, there seem to be increasing prices for needed products such as PPEs and oxygen. What is PAHO work with countries and suppliers to find that balance between price, quality, and strong supply chains? Doctora Etienne.
Thank you for this question. In fact, since January, countries around the world have struggled to gain access to the key supplies and equipment that they need to save lives, to protect healthcare workers, and to better understand the prevalence of the COVID-19 virus. In fact, there were market failures. The global markets for respirators, personal protective equipment, and lab testing supplies reeled in response to the tremendous needs and the difficulties of increasing production while at the same time observing social distancing. So in those early days, PAHO sent 27 tons containing more than 1.4 million critical PPE items to 25 countries from its own stockpile at the Regional Emergency Warehouse in Panama. We were helped by an unprecedented global supply chain that was established by WHO and other UN agencies and main international stakeholders to tackle that very challenge of supplying equitable access and delivery where they were needed. So you heard Ciro earlier. Actions are now underway to transport public health goods from Asia to Latin America and the Caribbean. And that's going to be done through PAHO's emergency warehouse in Panama. So this week, personal protective equipment will begin to arrive to this region from that source, including gloves, surgical masks, N95 masks, surgical gowns, goggles, and face shields, all of which are urgently needed in our healthcare settings. So the goods now in the pipeline may reach some 6,000 metric tons, which is worth more than $100 million. Most of these supplies are being purchased using the PAHO strategic fund that has enabled 12 countries to procure equipment and supplies from high quality and safety standards at a fair price. So we are especially grateful to the global support that we've received from WHO, but that global support to WHO as well, and the regional support to the Americas from important governments, Canada, Great Britain, India, and Japan, as well as the European Commission, the World Bank, and the UN Central Emergency Response Fund that provided a donation of some US $30 million to provide much needed supplies and equipment to countries in need. So we initially provided them, but there has been increasing needs, and through our strategic fund and through the global supply chain task force, we are looking to help member states to procure the supplies that they very much need. Of course, we need to say that in a situation like COVID-19, access to supplies, to equipment, to treatment, and to a vaccine when that becomes available, that this is essential to allow us to respond. And it must be done within a context of equity, within a context of solidarity, ensuring that those who need it most have access to it. So thank you again for joining us, and see you next week.
Muchas gracias, doctora Etienne. Gracias a todos por haber participado en esta sesión. Recuerden que en la página web de la OPS pueden encontrar más información, así como los datos de casos y fallecimientos por país y regional. Estaremos enviando en breve las palabras de la directora y también la grabación de la sesión. Y como no hemos llegado a contestar todas sus preguntas, recuerden que pueden seguir en contacto con nosotros a través del correo electrónico, que les estaremos contestando lo antes posible. Así que gracias a todos por participar y seguimos conectados. Saludos.